What I would like to share with you regarding this pandemic, it's a little bit the word uncertainty. Again, as a physician and as a neurologist, we are living, everything that is happening, recognizing that there are many unknown answers for the, everything that is happening. And this implies the healthcare model that we have and that we are using to face this problem. I have no doubt that physicians and the healthcare try to organize as much as we could in such a limit and short time to give an amazing answer. What we have known already is that having a strong public health care seems to be critical, and having what I would say a universal health coverage also has assumed an amazing impact in whatever happened during these months. So the long-lasting impacts no one knows. I tend to say that only bright people were able to anticipate and predict what happened, but there were some. And so we were not completely caught by surprise, probably the majority, but there was a minority that really alerted everybody for the risks of, a pandemic like the one that we are living. Working with Parkinson's disease and working with Parkinson patients, I cannot avoid sharing that the last large pandemic in the world took place 100 years ago in 1917. Unfortunately, it killed millions of people. It was a disaster in terms of healthcare and public health, but we have learned a lot in terms of neuroscience. There were huge developments regarding what we know already regarding sleep centers in the brain, about where the Parkinsonian signs were generated also in the brain. And 40, 50 years later, we were able to find that dopamine was a neurotransmitter, and then it was related with Parkinson's disease, and we were able to treat our patients better. So I hope that in line with what happened 100 years ago, we can still face this huge health problem, finding positive things, namely knowledge that may be helpful for, others, and not when the victims of this pandemic. I would say that the first big challenge was to adapt, and everybody adapted in very short period and in extreme circumstances. This was a very difficult period for physicians, nurses, all health professionals, mainly those who are working in hospitals and facing the crisis, face to face with the ill people. Now the big challenge will be to move to this new scenario. And really the challenge is to win fear and to regain trust. So coming back to the uncertainty, we don't know where are the patients that regularly were coming to the hospitals and suddenly disappeared. So it's amazing that the number of patients with infarctus, with cancer, that we were seen regularly, and we knew a little bit the pace of those new patients in a hospital, and suddenly the number of new patients decreased a lot. So, or just by luck, really, there was a reduction in the incidence of those diseases, what I don't believe it's the truth. Or we are also missing treating those patients. So the focus on the COVID patients really generated fear, and patients were afraid to come to the hospital, and probably they are suffering alone and at home from acute and very severe diseases. So the next challenge will be to regain the trust and win the fear, including fear of the professionals, because they have fear of facing their own weaknesses by working in the hospital, and reinvite patients to come because they need us. We know they are there, and I just hope that really what we will find in the next months is it's not a big surprise. Again, let's hope that this confinement in some way also reduce the incidence of some acute diseases, that because we are more confined, we move less, I would hope that really it would mean that really, the incidence of those medical problems would be not as severe. It's amazing how everybody suddenly learned to work with telemedicine in a question of days. Everybody, from young doctors to, elderly doctors, from young patients to elderly patients, from very healthy adults, citizens that just use the health system because they need to do some checkup, to patients with some cognitive impairment that are being helped by their sons, by their caregivers at home, and are able to respond to a consultation by telemedicine. It's really amazing. So I would say that we have progressed probably 10 years in the implementation of telemedicine and all type of, I would say, health support from a distance point. Again, we have learned a lot, and really we are finding that it's possible. So again, one of the interesting learning points is everybody is finding that it's possible to do it. It works. Even in some areas, it may work even better. I can share that suddenly I'm visiting my patients' houses without being invited. So I'm having some chats with their sons, with people that never came to a consultation. So I'm having access to some elements of the clinical history that before I couldn't exceed. So this is a different type of medicine. And again, in some aspects, it may be even better than, a formal, face-to-face visit consultation. But it's not what I'm recommending. I think what we will need to face in the future is how to combine everything. And I think the new model in terms of, medicine and healthcare will be combining the best of face-to-face visits that are critical for some aspects to the possibility to having a follow-up of the patients in aspects that do not demand, a face-to-face and personal observation from, using the web as a tool. And this may even, increase the quality and the intensity of some medical programs. Even in a field that I also know a little, again, what is happening, that is rehabilitation and physiotherapy and speech therapy and the work done by many health professionals, we are discovering that it's possible to do a physiotherapy session on the web. And we are also discovering that this is a new type of intervention. So we need, again, to be able to demonstrate what its efficacy and risks, because if a patient has an equilibrium problem, and if he falls, the physio cannot help them on the web. So it's there are new challenges, but really I think that almost in every area, even surgery, can be not being done, even if we can use, some bionic, tools to do surgery, even for not being in the operating room, but even in the follow-up after an intervention can be done by a distance point, and in that sense, we can improve the type of care that we are offering.